I recognize Dr. Ruiz for 5 minutes.
Thank you, Mr. Chairman. As many of you know, I grew up the son of farm workers in the medically underserved community of Coachella. I have seen firsthand what it means when a community is medically underserved and when they cannot access care. And I can tell you this, if it was not for Medicaid, the Coachella Valley and regions like mine all across the country would not have access to health care that every one of us up on this dais and our families enjoy. If we repeal Medicaid expansion, people will lose health care coverage. They will stop seeing their doctors because the cost will be too high, and they will stop taking their life-saving prescriptions because they are too expensive. In California alone, the nearly 3.5 million individuals who enrolled in Medicaid under the ACA expansion provision could lose their coverage. That's millions of families losing access to health care. And if we repeal Medicaid expansion, uncompensated costs will increase, straining our nation's healthcare systems, which will drive up costs for everyone. Because you see, when people don't have health insurance, they don't stop getting sick. And our emergency departments do not turn someone away because they don't have insurance. Emergency physicians treat the patients like they should. So the hospitals have to make up the costs. And in 2014 alone, Sutter health systems in California saw a decrease in uncompensated care by 45% in 2014. All hospitals in my district, in particular San Gorgonio hospitals, have seen a drop in uninsured patients in the emergency department by half. So we need to expand Medicare even more, make it more efficient, and more desirable for providers to see more Medicaid-insured patients. Listen, fraud is bad, and political amplification of the problem to wrongfully justify cutting health insurance for sick patients is bad. So here's the possible common ground. Here's what I think we can both agree on. If we start with the premise that we want to cover more uninsured, economically struggling families like the middle class and more vulnerable families, then we're on the same page. But if you start with the ideological goal to cut or end Medicaid, then you'll breed mistrust and millions of people will be harmed, including the middle class. So the real question, Mr. Howard, is, are sick and injured people getting the care they need? Because anything short of this is negligence. So let's tackle fraud so that we can expand coverage to more struggling, uninsured middle-class families. So the question that I have, Ms. Yocum, if you were to choose one thing that you can do to combat fraud, if there's one action that you can take that we can make the biggest difference in the system, what would that be?
I think it's around the providers, making sure that we have eligible providers who are in good standing and that those who are not in good standing and should not be providing services aren't going across states to provide services.
Thank you, Ms. Maxwell. The one thing that will make the biggest difference.
I would absolutely have to go back to the data. Without that sort of transparency, we cannot see what's happening in the program. And we have a lack of data across the nation and also data coming in from the managed care companies.
Thank you, Mr. Howard. The one thing, you had one thing that you can change to make the biggest difference in fraud, what would it be?
In fraud in particular?
Medicaid, yeah.
Yes, engage data transparency, as my colleague here on the dais was just saying. Medicaid data should be enclave for all the states to look at so they can benchmark provider performance and engagement.
Thank you. Mr. Westmoreland, what does the evidence suggest about how Medicaid expansion is making health care more affordable? Is there evidence, for instance, that Medicaid expansion is reducing patients' need to forego medical care due to costs?
Medicaid expansion is highly associated with a decline in personal bankruptcies. It is also associated with greater financial security for families who are newly eligible.
So these are middle-class families who are having some economic security because of the Medicaid expansion. What does the body of evidence say about how Medicaid expansion has affected patients' access to primary care and preventative care?
People in those beneficiaries who are newly insured under the Medicaid expansion have much higher rates of traditional sources of care, seeing primary care, and using preventive health services.
Thank you very much. My closing statement is, you know, if this is leading to increase in expansion for economically struggling middle-class families, then, you know, I'm in. But if the ultimate goal is to create a facade and amplify a problem politically to then justify policies that will hurt the middle class and that would decrease health insurance, then I'm not in. So let's tackle fraud so that we can expand more health coverage to middle-class families. Thank you very much.